Hi there, this is Connie Welch with LifeBeyondHepatitisC.com. I wanted to give you the video update for week 17 of being on the triple therapy treatment for hepatitis C. I've been using the protease inhibitor Incivek, which is also called telaprivir, along with Interferon and Ribavirin. At this date, on August the 9th, I've been off of the Incivek part of the treatment for approximately 9 weeks now. My side effects have definitely gotten tremendously better. They've improved. So I wanted to give you a kind of a recap of some my blood work to let you know on week 4 and week 12 of being the treatment that I had a non-detected virus load count. This last week I did my virus load count for week 16 and just received the results showing that it was also non-detected. So we're very excited because the treatment is working, and I have had 3 consecutive non-detected virus load counts. Also, my liver enzymes came back to be in low normal limits, and my white blood count and my red blood count that had dropped significantly is coming back up, so that's also improving. So we were just very, very pleased with the outcome of this. So I wanted to share that with you today, and also just encourage you that if you are on treatment, just to hang in there. I know particularly it's difficult, especially at the onset of treatment. If you're in your first 12 weeks of treatment, you just have to hang in there, really, every day, every week, and just get another one, checked off your calendar, because pretty soon time will begin to speed up. So I wanted to encourage you with that. And so I wanted to also tell you, I will see my specialist in 2 weeks. And at that time, he and I will discuss the treatment plan for what is ahead. He has said all this time that if my week 16 virus load test came back non-detected, that he would very much consider that my treatment could be completed at the end of September. For me, that means that would be a total of 24 weeks, which we originally were thinking I might have to go longer. But I've gotten very good results from this treatment, and just very excited about that. So, but at the same time, I don't want to get hyper-focused on that end of September date. To be honest, I was ready for treatment to be over that first week. And if you're doing treatment, you know that it just, it can be, you have your difficult days. But at the same time, the main focus needs to be to eliminate the hepatitis C virus. And this is working, and it's very doable. So you have to just press on and persevere, and to just get beyond every week and deal with the side effects and the helps that you can get for dealing with those. So this is we're excited, and so I will let you know and give you the update of what the doctor tells me, and we'll see when my completion date's going to be. But also, I wanted to explain something about how the virus load test is calibrated. Because what it was explained to me is that the way the test is run, it cannot detect any virus cells below a certain low number. And for genotype 1, which that's the genotype that I am, it will go anywhere from 7 to 43. It cannot really detect anything lower than that. So if there's active cells, and cells still there, then it will pick it up if it's like 43 and above, and if not, it cannot pick that up. But this is why the doctor had told me initially, once you get your first virus load test back and it shows non-detected, that's why you need to go longer with the treatment regimen, because you want to make sure that you kill any virus cells that are straggling out there. So it's important to go as long as your doctor feels is totally necessary. There is a certain protocol for certain virus strains for your treatment, and for chronic active hepatitis C and for genotype 1, it will depend on your virus load test that you get back and your blood work, and how your doctor feels like you are doing with dealing with your treatment side effects. And you need to have very good communication with him over that. So, I hope that you're getting good results if you are on treatment, and if you're researching this out, just have a lot of hope, because we're seeing a big difference. I have done treatment 2 other times. I have had hepatitis C for 20 years. And back in 1995, I did my first treatment, which was just interferon by itself. At the time, that's all they had out. And then I was only a partial responder during that course of treatment. And then in the year 2000, they had come out with the combination therapy of peg interferon and ribavirin. And also remember, I'm still genotype 1. Genotype 1 is a little bit harder virus strain to fight and stuff, but it still was very doable. There are several different virus strains, and your doctor will determine from your blood work what your genotype is, and the best way to respond with treatment, course of treatment for you. But during this time, back 12 years ago, they only gave a 20% chance of getting the virus to even go into remission. And so now here we are 12 years later from that last treatment, and they have improved things so much. And now there is a 70% cure rate for the virus itself. So there has been tremendous strides made in these last many years. So we're very hopeful that this could even open up doors to so many other chronic conditions of other diseases that this could help. But right now we're just extremely encouraged and excited that this treatment is working. So again, I will see the doctor in 2 weeks, and then I will let you know what he has said. Just a recap of kind of side effects. I know in my last video I shared kind of in some detail about the different side effects that I was dealing with, and that's still continuing. This week I did not have quite as bad a reaction for my interferon shot. I take the shot on Monday nights, and normally the couple of days following that we'll have some low-grade fever, some muscle aches, might have just a little trouble sleeping, but this week it wasn't too bad. So that kind of the low-grade fever has kind of passed, and the muscle aches have passed. Appetite still is going up and down some. One of the things that I've heard other patients talk about is food cravings, and I guess really I have had some of that. The one thing that seems to be the most refreshing thing and satisfying to me is sweet tea. And normally prior to treatment, I did not drink sweetened tea. But for whatever reason, that seems to be what is tasting good to me right now. So you know what? I'm okay with that, because if that helps me get beyond treatment and is something satisfying to me, then that's okay. I've been able to lose some of the weight that I initially gained while I was on the Incivek part of the treatment. But the weight issue is really nothing, because the main focus is to get healthy, and I can regain my normal physical activities and things like that as I get off the treatment, and recoup and have some time with that. So I'm doing really well, doing very good. So we're excited with this latest news and wanted to share that with you today. And stay tuned for the update for this next week. And if you would like to go to my website, lifebeyondhepatitisc.com, and check out a lot of the resource and support information there, I hope you find that helpful. So stay tuned for next week. Talk to you then. Bye-bye.